The knee is absolutely essential for movement and ability. It allows us to do any activity that we perform, from simple walking to running, jumping, dancing, or kicking a ball. A ligament is a tight fibrous band that connects two bones to each other, usually in or around a joint. And what ligaments do is they allow joints to move without becoming unstable.
There are 4 primary ligaments in the knee that we think about: the MCL, the LCL, the PCL, and then most importantly, the ACL.
The ACL is in the center of your knee, and it basically provides both rotational and forward stability to your knee.
So the ligaments have some give to them, but they have a breaking point if a joint is moved in a way that it wasn't meant to.
There are 2 main ways that the ACL gets injured, especially in a sports context. The first is simply if someone gets struck in the knees, but actually, interestingly, just as if not more commonly, are non-contact injuries to the ACL, when basically a player stops and turns or twists or moves to the side, and the combined force of the body rotating or turning or twisting is too much for the ACL to withstand, and it tears.
For most athletes, having an ACL tear means having a surgery to reconstruct, or in some cases to repair the ligament. So it's unusual for an athlete to return to competitive play in really less than 9 months.
We're talking about young people who are planning the arc of their lives based on what they can athletically achieve during their teenage years. So an injury can take them far away from where they want to be.
So we know that female athletes are facing an uphill battle. There are lots of different challenges that are unique to them.
There are a number of reasons that we've hypothesized that female athletes are more prone to these injuries. Some of them have to do with anatomy.
After you go through puberty, your hips get wider and your knees are closer together, which tends to put the knee in a little bit of a risky position.
We also think hormone levels may play a role. There have been observed to be some differences in the frequency of ACL injuries at different portions of the menstrual cycle, for example.
And then finally, there's probably a training or a biomechanical and strength difference, and that leads to a little bit of an imbalance.
It is really difficult to adjust to this, life-altering injury, especially in a period of adolescence.
That can change their sense of self, their sense of self-worth, how they relate to their peers. It's really important to meet those athletes where they are and then come up with a positive kind of strengths-oriented plan to get there. The goal of the program is to provide a safe, evidence-based medical home for female athletes so they can get tailored care to themselves to help them reach their peak goals.
Our team includes an orthopedic surgeon, non-operative sports medicine, adolescent medicine and gynecology, pediatric and adolescent psychology, athletic training, and nursing support.
We think we can address a really broad array of potential injuries and issues. Those would include concussions, any type of orthopedic injury.
We also, though, really want to look at their overall health, so nutritional concerns, concerns related to menstruation. There's so much to be said about the importance of psychology to treating athletes, and we feel that that's a really essential component.
There are increased pressures to perform in a certain way, there are body image concerns, and we know that female athletes are at twice as much of risk for experiencing depressive symptoms after an injury. We're working on helping these young athletes navigate that journey.
No 2 athletes and no 2 teenagers are the same.
We have a lot of time that we allocate for each of our patients. We're really able to get to know the whole person and take all of the medical, social, psychological, and orthopedic structural stuff into account.
When I see someone who's not just healed from their ACL surgery, but is feeling healthy, feeling ready, feeling mentally strong, feeling like they've got their nutrition worked out, and goes back to sport and succeeds and feels great about themselves, that's the best possible feeling.